Hello everyone, welcome back to my YouTube channel. Or you people are new over here, then a warm welcome to my YouTube channel. In the previous video, we have talked about the details of high blood pressure, and today in this video, we are going to discuss about the topic of low blood pressure, that is hypotension. So let's get started. What is hypotension? As the word indicates hypo means low and tension means pressure, that is low blood pressure. So before knowing about low blood pressure, at first we should be knowing something about blood pressure. So let's get a brief about blood pressure. Blood pressure is the force of blood pushing against the wall of blood vessels. Here we can understand that blood pressure is the process of pushing blood against the wall of our arteries by some forces or pressure. The force is generated with each heartbeat as blood is pumped from the heart into the blood vessels. So, from this, we can get to know that the maximum pressure exerted by blood on vessels wall during contraction of heart chambers is to be called as systolic blood pressure, and diastolic blood pressure is minimum pressure exerted by blood on vessels wall during relaxation of heart chambers. Blood pressure is usually expressed in terms of systolic maximum pressure over diastolic minimum pressure and is measured in millimeters of mercury mmHg. A blood pressure reading lower than 90 millimeters of mercury mmHg for the top number systolic or 60 mmHg for bottom number diastolic is generally considered low blood pressure. Having lower blood pressure is good in most cases, but low blood pressure can sometimes make a person feel tired or dizziness. In those cases, hypotension can be a sign of an underlying condition that should be treated. Normal blood pressure of adults aged 18 years is 120 mm of Hg systolic and 80 mm of Hg diastolic blood pressure. So, let's talk about the symptoms of low blood pressure. Number 1 symptoms of low blood pressure could be dizziness. Dizziness is the sensation where the person feels unsteady or spinning around and losing balance. This can definitely happen with low blood pressure because our brain is not getting required amount of blood, and that could affect our ears, leading to the dizziness sensation. And now, number 2 gonna be a lightheadedness. Lightheadedness is when you feel like you might faint. It is one of the most common symptoms of low blood pressure. Here, your vision might also be affected. And the number 3 is losing consciousness. This happens when your blood pressure drops or you are not getting enough blood in your brain, and the brain tells the body better to lose consciousness so that the brain is not active. When the brain is not active, brain unable to perform the activities required with low amount of blood supply the brain is receiving. Number 4 gonna be thirst. When you have a low blood pressure, you feel of needing or wanting to drink something. It's a sensation of dryness in the mouth and throat associated with the desire for liquids, especially if you are dehydrated as well. Dehydration is the cause of your low blood pressure. And number 5 gonna be a brain fog. Basically, in this situation, you might feel uncomfortable of being spaced out. It can make it difficult for you to focus on tasks at hand, remember things, or with brain fog, a person feel less mentally sharp than usual. Number 6 going to be a blurry vision. Number 7 going to be a palpitation. When your blood pressure is low or dehydrated, the heart actually tries to pump more. The heart tries to pump faster. That could lead to rapid heart rate, or some people actually feel the heart beating. That could be palpitation, and you can definitely feel that. And number 8 gonna be depression. Yes, you could be depressed if you are feeling weak, tired and lightheaded. You are unable to involve yourself in your daily activities. That could definitely lead the sense of depression. So now let's talk about the causes and treatments for low blood pressure. Low blood pressure or hypotension is commonly seen in young women of reproductive age group. The most common reason could be dehydration, anemia, nutritional deficiencies, or low salt in our diet. If you do have low blood pressure, ensure you drink lots of water, eat nutritional food, and have more sodium in your diet. It is advisable that you consult a doctor to get more information about this. Thanks for watching.